Let me see. I think we're live now. Yep.
Okay.
So let me see. Just a second. Yes, we are. So, how do I start? Yeah. Good evening, everybody. If you're watching, welcome back to the channel. I usually say my name is Dr. Ron, and I talk about everything healthcare. And today we have Dr. Uche with us, and she's a physician scientist, right? Am I right?
Yes, you're
Okay.
correct.
So she'll be
Mhm.
sharing a bit of her journey with us and how she got to where she is today. So I'll hand over the mic to you. So let's meet you, Doc.
Okay. Hi, everybody. My name is Uchenna Obieyisi. Some people call me or know me as Dr. Cleo on Instagram and some other social platform. So I'm a physician. I've practiced clinical medicine hands-on for a couple of years now. I had other interests alongside while I was doing that. Interest in research. I also did a little bit of public health advocacy alongside. But currently, I'm in my journey to being a physician scientist. Currently, I work with an organization in the global medical affairs.
Okay, so can you
Uh,
tell us a bit more of what you do? I mean, you said you're on a journey to becoming a physician scientist. Is it that you're not there yet, or?
no, I'm actually there, but like I mean, there is no end to to where you can get to. Like there is always growth. There's room for
Yeah.
growth, right? So like I like to say myself, I always tell myself like this is just a stepping stone to where I'm headed because where I work. I mean, there is the reason part of the reason I chose this path or journey. It's because
Yeah.
it allows me room for more growth. So that's why I put it in that form.
Okay. So
So
basically,
okay.
okay, go ahead, go ahead, go ahead. Let me
No,
allow
because you
you.
asked me a question.
A bit of what you do, what you basically
Right,
do. Yeah.
right. So, as a physician scientist pretty much is an MD or DO who, has or acquires new knowledge for healthcare or diseases through research, basically.
Okay.
So, for me, I like I said earlier, I work with a global organization, fantastic one at that.
Okay.
So, as a global medical affairs scientist, so pretty much from in a nutshell, what we do is from first of all we identify and then we fulfill our medical needs by generating scientific evidence and alongside also delivering scientific value to key stakeholders, patients like the consumers and HCPs and all of that good stuff. Whether be it from developing new therapies to supporting the existing ones to partnering with experts to communicate our clinical and scientific expertise and you know just making that input in the medical community and also um, to the patients as well.
Yeah.
So in a nutshell, that's what we do pretty much.
Interesting. So basically, like research, 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 and more research.
Yes. So, like I said, it's more like you identify where there is a gap, right? Like, for instance, I'll give a scenario. Let's say um, treatment of an elderly patient, like
Okay.
managing pain in an elderly patient. So most times there could be there could be a limitation in terms of maybe therapies to for this particular age group, maybe due to
Morbidities.
comorbidities
Yeah.
in those patients, right? So you want to go into those areas to search how best can I deliver better health for this patient or for this group of people. So you go into research, try as much as possible to get as much scientific evidence you can get. Even if it means you developing, new therapy, just so that you can include those set of people, we go all the way to that point. So pretty much you can develop. They already, like I said, they're already pre-existing therapies. For instance, you can decide to use a strong analgesic for an
Okay.
elderly patient, but also remember that some of them might not be, due to their comorbidities, might not be eligible for that, right? So those are the areas you want to go into, or even just a way to make them feel better for like patients that have osteoporosis or osteoarthritis, sorry,
Yeah.
that you want to, better care for them, and you want
Okay.
something, better for them that can, alleviate their pains, because maybe if the regular therapy is not working, you want to, go into that area, do more research, and how best you can, deliver or better health to these patients or to
For
these
them.
people. So
Yeah.
that's the part, which is the innovative part, where we, from the research, we, from finding the needs, identifying the need, to fulfilling them, then you go into developing your therapies, and doing all that you have to do to, deliver a better health for your patients, who are in turn your consumers, pretty much.
So looking at your role now, I mean,
Hmm.
are you usually on the field? Like, I mean, because if you're doing this type of research, probably you might need to be on the field, or do you manage a team, or how does it work?
So you do. I'm not always on the field.
Okay.
So pretty much we can use already existing data,
Okay.
right? So we don't have to reinvent the wheel if it's already existing, right? So
Right.
most times we can communicate, we can develop our own research, we can do real world evidence, right? Right there on the spot,
Yeah.
with other functional aspects. So remember, it's an organization of different teams, medical affairs experts, which where I am. You
Yeah.
have your regulatory functional aspects, you have your clinical development, you have your other team members, right? So it's like a team work, team effort. So first of all, we identify, okay, what do we have? Are there enough science? Are there enough data?
Data,
To,
right?
yeah, exactly. So if they're not there, we can start by, okay, how do we get all the data to be able to support, providing the need for this consumer or patients, whichever way you want to call it.
Yeah.
So is it that we use the existing one, we can develop one if need be. So to answer your question, no, I'm not always on the field.
Okay. That sounds interesting.
Yes.
So I mean, so looking at your background now, I know you're
Hmm.
a doctor. So how did you get into this space now?
Okay. So basically, for my role, you have to be an MD, or so because my team is about team of 12 people, right? All of us are
Okay.
medical doctors, and
Ah,
then maybe a couple from PhD holders to plus
okay.
PhD holders, and as well tons of experience in healthcare organization.
Okay.
So to answer your question, like I said before, as a physician, I knew that hands-on clinical practice was just not enough for me. I wanted more. I wanted more. So and like I said, back home, while I was doing hands-on clinical practice, I was also doing research, mostly in respiratory and oncology, and
Okay.
public health here and there. So for me, I your question was regarding.
How
Can
did
you
you
repeat?
get here? Yeah,
Okay,
how did
so
you
first of all, I decided on the path that I wanted to go, which was what I'm doing currently. First, early on, it wasn't easy. It was a bit of struggle because everybody would be like, "Oh, why didn't you take the regular path? Do the regular thing." But I always tell people your journey is peculiar to you. So my path, my journey is peculiar to me, and because of some, the area that I had interest in and the area I had passion, so much passion, I decided to, follow this route.
Yeah.
So I started my journey in becoming a physician scientist 2018, pretty much after when after I relocated here to the US. So I first of all started by doing my research. Remember, have in mind that I already identified this is where I have so much interest and this is where I
Yeah.
had so much passion. So I had to start doing a whole lot of homework to get all the information, all the resources that I needed to be very sure of, if this was really it. So at the point where I gathered all the information from researching, I did my personal research, reached out, which was pretty much networking. So I reached out
Okay.
to a whole lot of people that were on similar path, and I was able to get a lot of idea. So in this journey, I would say mentorship was very important for me, connecting with people, and looking, hearing their story and their journey. So initially, it was a lot of struggle. When I eventually came to this decision, I had to do my work, my homework, which was pretty much tons of research, getting myself up to date, and acquiring all the certifications that I needed. So, first of all, as I was working as a clinical research associate and coordinator, I was alongside, getting my certifications both from Hopkins in epidemiology and from Harvard in the areas I was interested in. I also
Okay.
got a certification in clinical research alongside, and also did a whole lot of I got a whole lot of mentorship as well. So those were the things that helped me, after I felt I had gathered enough, not experience, and also the skill set that I needed as well.
Yeah.
Because I mean, you have to be someone that is very detailed, very detail oriented, and organized, structured, and all of those good stuff. So I started putting out my application, and I was able to land this role in, I believe, 2019. That's where I started my
Okay.
journey, and since then it's been an amazing and interesting journey.
So you've been going up and up and up.
Yes, yes. So it's been growth. And what I tell, for me, I just wanted to I first of all, it was challenging. It's still challenging because for you to grow, to get to the peak of your career, I mean, it's not it takes a whole lot of work, right?
Mhm.
So yeah, currently I've been putting in a whole all that it takes and all that it requires. So pretty much doing your homework. And
Interesting. So talking about because you mentioned a couple of certifications. I mean, are there any key certifications that anybody who is probably thinking of coming into this space needs to be aware of or needs to do?
okay, so thank you for that question. Like, honestly, there's a lot of people that have reached out to me, mostly on LinkedIn. So LinkedIn was the platform that I used. That's
Okay.
Yes, it's so a lot of people have reached out, asking how did you get into this role? How did you arrive here? What did you do? So now, there is no hard and fast rule about it. The journey is different for different people. I'm sure if you talk to another physician scientist, his or her journey is definitely
It's
different, right?
different.
So
Yeah.
they probably started from, getting their masters and their PhD and all of that, right? But you definitely have to be an MD, licensed
MD.
one. So um I don't think so. It depends, because it depends on the area you want to focus, right?
Ah, okay.
So if we have safety physician, we have pharmacovigilance, medical writer, medical reviewers, and
It's a
all of
whole
those.
lot, really.
Yeah, so it's a whole lot. So for me, I think the first thing is identifying what are the areas you are interested in, which are the areas, and what are the things you have passion for. Where do you see yourself? There are questions you need to ask yourself first.
Yeah.
First of all, you need to discover what is the purpose. For me, it has always been, even when I went to medical school, it has always been, I've always had a passion to help people feel better, have their best life, right? So that has always been the thing for me. From childhood growing up, I knew I was going to be a doctor. And, it wasn't an easy journey. You can relate to
Yeah.
that.
I
If
know.
you
I
can
know.
imagine that. So it starts by identifying your purpose, what you really want, right? So if you decide, okay, I'm going to have a better fulfillment being a physician scientist, or being a physician. Safety physician is towards, pharmacovigilance, safety of adverse drug effects and all of that. So you have to identify, if you don't want to do hands-on clinical practice, what are the other things that you have interest for? What are the other things you're passionate about that you can deliver the most, right? So
Hmm.
if you identify that, and then you can now streamline your your research, your homework to that direction. So I mean, except if the person wants to be in medical affairs, then I
Yeah.
can give all the, but like I said, the basic things you need, it's be a licensed MD. You can get, if you're interested in drug development, you can decide to get an MS in drug development,
Okay.
or you can go further to get a PhD if you want. But for
Okay.
me, my journey, it was more of certifications, networking with people, getting all the information. I mean, there are vast tools you can use, resources. Some of them you don't even have to pay for them, right?
Mhm.
So you can do that. And but the most important thing is identifying what area you want to, grow, or what area you see yourself, doing the most.
Yeah, I think I quite agree with you because I was once speaking to somebody last week. So I think she's a medical writer. So all she does is the whole technical,
Right.
writing about research, breaking it down to layman language and all of
Mm-hmm.
that. So I think she mentioned a couple of courses she was taking. So it was a bit different from maybe some of the regular things I know. So she echoed this same thing you're saying. I mean, it differs from, clinical research or
Mm-hmm.
is vast. So
Right.
you just have to, pick an area to
You want to concentrate. And
eh,
for me, I will tell people, don't just do, let your journey be peculiar to you.
to
Don't just
you.
take this part or choose it because other people are choosing it. No, choose it because that's where you have passion. That's where your interest has been. Because I believe if you have your interest there, if you have your passion, then you're going to give it your best, and you see yourself, getting to the peak of your career. So I think, yeah.
Okay, that's fine. I think we even have a question here. Mohammed is saying hello. I don't know if
Hi.
I don't know if you know him.
I don't know him.
Okay.
From where, Madonna?
No, on LinkedIn from LinkedIn. So he said,
Oh,
"Hello, Dr. Cleo." Well, so he might probably know you.
well.
Then there's a question here. He says, "This is someone else says, does one require a U.S. medical license to get started?" Which I think you've answered yes.
Um.
Then
Okay, I will come back to that question.
all right. Then he says, "I have a master's degree and I have
Mhm,
worked on early and late phase clinical trials as a research clinician. What
mhm.
options do I have?"
Okay, so let me answer the first questions. The first question, which was about
Do you
license in
require a medical
US,
license to
in
US
the
medical license?
so it depends on the organization and also the role you're going for. So different organizations have different healthcare organizations, I mean, have different requirements, right? So
Okay.
some of them you don't necessarily have. Maybe if you're licensed from your home country, that's enough. But some of them also you need to be licensed here in
In
the
the
US.
US. Okay.
Like for example, if you're going for a safety physician role, most of them will ask you for a US medical license.
Okay.
Why some of them won't, like I've gone through those, some of those requirements, some, and it differs. So if I would say, because that was the same thing I did my examinations and all of that, so I would say it's good to have it if you can. However, if you really know that, oh, you don't want to, and then the area you're interested in does not require that, then you don't have to, right? You
Yeah.
just go for what you really want. And then the second question you asked was about, what was that again?
It said, I have a master's degree and I've worked on early and late phase clinical trials as a research clinician. What options do I have?
So you do have tons of options. The question you should ask yourself, what areas, how do I narrow my career, where do I want to focus? Like I said, if you, in most healthcare organizations, I don't want to call names, so there
Yeah.
are so many. You can become an MSL, which is directly working with the physicians, which you're also a physician, so you relate more with them. Most MSL position, which is medical science liaison,
Yeah.
you're working with other expert trades, so you need to be an MD because you speak the language of a doctor and all of that. So there are so many tons of things you can do. Medical affairs requires you also to be an MD, and but I've explained to you my role is mostly identifying those unmet needs, and
Needs,
through
yeah.
generating scientific evidence, providing scientific, delivering the scientific value for our key stakeholders, the patient, consumers, and all of that. So if medical affairs is an area you're interested in, then you can also pursue that path. So what you need to do is go do your homework, which is do your research. I mean, do your research and ask, look for the resources that you need. Some of them you don't necessarily have to have your masters or whatever. Why? Like I said, the basic thing is being licensed MD, whether in your home
MP, yeah.
country or here in the US or whatever. Then try to having an experience. So I would advise, first of all, decipher what area you want to go. There's regulatory affair, which is more dealing with the FDAs and registration and all of that good stuff. So
Okay.
it depends. Research or put in the if you're not very sure of the area you're interested in, you can just put in your Google or wherever. You can say roles that an MD can do. I mean, if you don't want to, the non-clinical practice, if you
Art,
want to,
yeah.
yeah. If you put it in, you see tons of them, and then you can read in on each and every one of them to see, because sometimes initially might be confusing to you to narrow down what it is that you want or that you're interested in. And also
Mm-hmm.
bear in mind that some organizations have different names for these different things. Like my role as a medical affairs scientist, some organization might have it as MSL, which is medical science liaison. Pretty
Mm-hmm.
much is the same thing. The only difference is that as medical affairs, we go as far, aside from consumers and which are the patient now, we go as far as the
Mm-hmm.
commercial, right? So it all depends. So first of all, find the area. I would advise, once you're able to get that, find area you want to focus on. The next thing you should do is try to network, try to get in touch with people that have similar, role. I would advise using LinkedIn is a great tool, it's a great
To
platform.
use, yeah.
Yes. You see a whole lot of people, some people are very much open to mentorship. You can
Mm-hmm.
reach out to them, listen to their journey, and you can interact with them. And sometimes you can never tell, they can recommend you. I mean, if you have worked with them before, and if you have all the good stuff. So yeah,
So
there are
MD,
tons of
I
yeah.
hope that's clear enough for you as to your options and what you have to do. Kema is here. I think he's made a
Hi,
couple of
Gemma.
comments. So he said,
I remember Kema. I can't forget that name.
yeah. So he said the clinical fast track provides training and certifications for CRAs and CRCs.
Okay.
CRAs are clinical research associates and
Associates.
CRCs clinical research coordinators. If you're
Mm-hmm.
watching, yeah.
Mm-hmm. Mm-hmm. You
Then
can also get those from universities too. I mean, if you want the name like Hopkins and all those good
yeah.
Harvard and all of that. Yeah.
So and he goes a step further. He said most studies require CRCs, which IMGs usually take advantage of because it allows you to work close to the physicians. And IMGs in the USA are better off as CRCs. And just like you said, networking as well as getting certified will be very, very helpful. So
Mm-hmm. Mm-hmm.
yeah. So Kema is like, I'm going to bring you on the show one of these days.
We should
that's
do
uh,
that.
that's fine. So in terms of work-life balance, what does it look like? Because I mean, a lot of persons who are looking to transition out of clinical medicine proper. I think one
Mm-hmm.
of the reasons is like work-life balance, issues around burnout, and all of that. So what does it look like on your own side?
Right. So for me, I would say the same because, I mean, like, aside the fact that I had other interests, for me, if you know me very well, family is very, very important to me. I wanted just to be, not just to be a mom, I wanted to be a present mom, if you know what
Mom.
that means, and also a present wife too. So, and also be, and also be a career woman. All of that in one person. Oh my goodness. To be honest, it's not easy, but I will tell you, I'm not sure that I would have been able to get as much work-life balance that I have with my current role.
Okay.
Yes. So most of the time I work from home. I'm able to be present for my kids. I do have two lovely twins, so I'm able to be there for them and to support them and all of that. So I would say if I were doing like hands-on clinical practice, it would have been a lot more struggle for me because you know the timing not being present and all of that. Except maybe you can be a digital, which in most cases is rare. So yeah, I would say that my work-life balance has been great. It's not 100%, don't get me wrong. It's
Yeah,
not
I know.
100%, but I'm very grateful where I am because I'm able to deliver as a mom and also as a career woman. I'm
Woman.
doing yes. So, and my role has, allowed me that opportunity to, be both and be good at it, if I may say.
So that means
So,
more people are going to come into this physician scientist area.
yeah, I mean, it's the thing is, a lot of people lack the information that they need. In fact,
Yeah,
which was why I even though with my tight schedule, I still chose to come on here to talk a little bit of other options and other paths.
yeah.
To be honest, I couldn't have been any happier, doctor. I'm very grateful that I have this role and the growth that it allows me, and as well as that work life balance for me. I'm very grateful for.
That's nice. So, in terms of pay, though I'm not asking you to quote figures now, is it
Mhm, mhm.
lucrative? Does it pay well? Mm,
So I would say you can Google it and research. You can research it yourself and see it's great. It's great. I won't lie. It is great. It pays really well. It is great. However, what I always tell people, it's not, sometimes you just don't choose a career because of the money part, right?
yeah.
I mean, as much as we
No,
all
it's
need money
important.
for family. For me, the main thing, the first and foremost thing was, having that fulfillment as a career woman, right? And
Mm-hmm,
also being able to give my best to the patients, the consumers.
mm-hmm.
So that for me was first thing. Then in terms of the pay now, yeah, that's
It's
luckily,
very good.
yeah, with this role I was able to get everything that I wanted. So it's an amazing, it has a very, very good, and the good thing is that you can grow as much as you bring a whole lot of experience, a whole lot of good stuff to the table. Because
Okay,
if you're asking for, sometimes I say there's no limit to what you can earn. You
ask
can go
for,
as far as, yeah, you can go as far as those high figures. Some
but you
people
need to
here
be
in
able
America
to
that do.
justify why you're asking for those
Exactly. So,
numbers.
but you need to, be very prepared for that. You need to have the substance, to be able to put that on the table. So,
That's interesting. Well, I think that's fair enough. I mean, it's equal to the amount of energy you put in every day.
right.
Yeah, exactly. So for those who are thinking of coming into, yeah, okay, Kemam just mentioned something. He said not just the pay, the jobs are gratifying, good
Mm-hmm.
healthcare coverage, travel around, and
Mm-hmm.
working with top-notch PIs, that's principal investigators.
Right.
This builds your personal skill in research, and the sky remains your limit. Hmm. Now I'm being tempted to shift, but I'm not shifting.
No, honestly, because I mean, I don't even want to talk about all the perks. I'm tempted to, but like, it's interesting. I mean, most times if you have to travel, you travel in business class and all of that. But
Are you serious?
but that's by the way. Like I said, I mean, those are not like the main thing.
The main stops, right?
Yes, the most important thing is that you qualify yourself for the role you're looking for. If okay, Google, what does a medical director earn? So what do you bring to the table? What qualifies you for that role? You need to be equal to the task, right? So there
Mm-hmm.
is no limit to what you can earn. The most important thing is developing yourself, your skill set, and giving it, and it just speaks for itself. You're not financially, you're not going to have an issue. Trust me.
Right.
Yeah.
That's very reassuring. Any word of advice for anybody trying to come into this area?
um. Okay. So first, sorry. First, I would say I've said this a lot. I'm going to say it again. Your journey is peculiar to you. It's your journey. So make it yours, own it. What do I mean by that? What I mean by that is pretty much understanding your purpose. It's because, I see a whole lot of people doing this because people are doing that.
Yeah.
And for me, it's never worked for me. I don't, so I would say understand your purpose, your journey, and let it be peculiar to you. So understand that, okay, this is the area where I'm very much passionate about. This is the area where I can give my best. This is the area I see myself growing. I have everything that I need in terms of work-life balance. You have the fulfillment, you
Mm-hmm.
have you get from a career, right? And also it's an area where that you get all the most challenges. For me, I wanted to be challenged every day, so I'm always on my, I have all that adrenaline pumping, right?
Pumping.
So I never want, one thing I never want to be is complacent or be, continue to be in my comfort zone.
Mm-hmm.
I'm not that kind of. So I would say, um find your purpose and start your journey. It's never too late to start what you have interest or you have passion about. And while you're that, don't at, at this time and age, the resources are out there for you at any point in time. You can wake up at night or in the morning or anytime and just put on your Google, oh, medical affairs role, and then everything boom comes out for you. So there is just no excuse, right? So
Mm-hmm.
my advice for anybody would be, don't feel don't remain in your comfort zone. If you're doing something, challenge yourself don't limit yourself to that role or to that career that you really really desire. Challenge yourself to it. If it's something that you want to do, go for it. Don't let anybody stop you or anything stop you, or whatever thing it is. Just identify it, go for it, get all the information that you need. Google, prepare yourself, build your skill set. You have to be organized, and I already mentioned all of that earlier. Build your
Mm-hmm.
skill sets, get all the certifications you need from good schools or good places. Then you can even go as far as getting your master's, your PhD, whatever you have to do for that role,
Do
do it.
just do it.
Yes, don't limit yourself, because I mean, I'm someone, I like to aim high every minute. I'm here now, but I still want to be higher, and like that. So that should be the thing, and that keeps the fire burning in you. That would want to keep you to want to do more every moment of your life. So I would say, go for it, and everything is at your beck and call. All the resources you need is there. So there is no excuse. There's no reason. Network as much as you can. For me, LinkedIn is enough. LinkedIn is a
Right.
professional platform. That there are tons of people. If you go to search on LinkedIn, people that are doing similar role or career, whatever it is that you need or want or desire, it comes up boom for you.
Get it.
Thousands of
Yeah.
people, and you connect with them. Be open to mentorship, and there are people that are very good enough to offer that to you. So, with that information, you can never lack. You won't perish. You get to pick of exactly. You get to the peak of where you want to get to.
Where you
So,
want to
my
get.
advice is
Yeah.
just pretty much focus on you, build yourself, and go for it. You're definitely gonna have it.
All right. Then my last question now, talking about mentorship, are you open to mentoring anybody? I know you're very busy, your schedule is tight. Can we reach out to you?
um. Okay.
I hope I'm not putting you on the spot, but I mean, some people might chat you up after this session, so that's why I'm asking.
To be well, for me, it's okay. I'm open to it. Before you ask this question, I already have people that reach out to me on LinkedIn, most especially. I try
Okay.
as much as possible. I'm not always on there, but I
Yeah.
try as much as possible to respond to them. If I need to, I mean, we need to talk or whatever, give them ideas, clues, information, resources, whatever it is that they need and they require. So
Okay.
yeah, why not? I'm very much, I mean, people did that for me. I'm still very much open to that
Right?
too. So
Pay it
yeah,
forward.
exactly.
All right. I wish we could continue this conversation, but I think we'll have to wind down for now. So again, a
Mhm.
big thank you for squeezing out some time to come on, tell us about yourself and your journey and how you got here. And if you guys are watching, I hope, I mean, it's been very insightful for me. I've learned a lot too, even though I'm not transitioning to their area, I'm sticking to my pathway. But if you're thinking of moving to, physician scientist and all of that, I mean, I hope
We
it's
should.
been inspiring and at least you have an idea of what it takes and the benefits and all of that. So, yeah, thank you again, Uche, for coming. And yeah, thank you, viewers. And it's like come your way next week again. So be
Right.
good out there. Bye for now.
All right. Bye, guys. Thank you for having me, Dr. Casey, and take care.
All right.
All right. Bye bye.